Hi everyone, this is Lingana Gulat, your pharma student, and today we are going to discuss about the adverse drug effect, and it is also known as the adverse drug reaction. And we are also going to discuss about the types of ADRs. So, don't be late. Let's get into the video. Going for today topic is adverse drug effect, and it is also known as adverse drug reaction. In general, it refers to any unintended and harmful responses to a medication which administered at normal doses, and these effects can range from mild to severe and may also include symptoms such as allergic reaction, toxicity, or organ damage. And it can also result from the drug's pharmacological action which interacts with the other substances or individual patient, and these factors such as genetics underlying the health conditions. Types of ADR. They are divided into six types. Type A dose related, type B non dose related, type C dose related and time related, type D time related, type E withdrawal, type F failure of therapy. And they are mainly divided into six types which are dependent upon their functional characteristics. Type A refers to the augmented. The type A is also known as the dose related. The type A adverse drug effects are predictable and dose dependent reaction to the medications related to the drug's known pharmacological properties. And this type A occurs due to exaggerated responses at therapeutic dose that too high. So examples of type A reaction includes hypoglycemia from insulin and other diabetic medications, gastrointestinal bleeding from the non-steroidal anti-inflammatory drugs, nausea and vomiting from the chemotherapy drugs, drowsiness from sedatives, hypotension from the antihypertensive drugs. And these type A reactions are generally easier to identify, easier to manage, related to the drug primary effect. And type A is a completely dose dependent, which increases with the higher doses. And understanding of type A reaction is crucial for the healthcare providers to monitor the patient for potential adverse effect, adjust dose or switch medication as needed, provide appropriate treatment and management the strategies. And type A are more common, dose related and mostly preventable and reversible reactions. Type B stands for bizarre. A type B drug reaction, also known as idiosyncratic drug reaction, is an unpredictable and rare adverse reaction to a medication, and these reactions are not dose dependent and occur at any time during the treatment, and they also often serve and can be life threatening. The characteristics of type B reactions are unpredictable, rare, non-dose dependent, severity varies, variable time of onset. So, in this unpredictable cannot be predicted based upon the drug pharmacology of the patient or characteristics. Rare occurs in small percentage of the patient and during taking the drug, and non-dose dependent. It can occur at any dose, even at low dose or at a high dose. Severity varies. It can range from mild to severe and also leads to the life-threatening. Variable time of onset. It can occur at any time during the treatment, even after long-term use or short-term use. Examples of type B drug reactions are severe allergic reactions, agranulocytosis, thrombocytopenia, hepatotoxicity, Steven-Johnson syndrome, and toxic epidermal necrolysis. In these, type B reactions are often immunomediated and may involve in genetic predisposition, and they also require immediate medical attention and treatment, and the offending drug should be discontinued. In type B reaction, some of them can be prevented and predicted if their genetic basis is known, and these type B reactions are less common and non-dose related. Type C. C stands for chronic, and it is also known as time related and dose related. The type C drug reactions are also known as dose related or augmental reaction, and these are adverse reactions that are directly related to the dose of the drug, and they are predictable and typically it occurs in larger percentage of patients during taking the drug. Characteristics of type C drug reactions. So it is a dose dependent, predictable, common, reversible and gradual onset. First one, dose dependent. The severity of the reaction increases with the taking of the dose. Second one, predictable. It can be anticipated based upon the drug's pharmacology and the patient characteristics. Common. It occurs in larger percentage of patient during taking of the drug. Reversible. Typically, it resolves the when the drug is discontinued or the dose is reduced. Gradual onset. It may develop gradual over time during the taking of the medication. Examples of type C drug reaction. There are gastrointestinal upset includes nausea, vomiting, diarrhea with non-steroidal anti-inflammatory drugs.
Second one, sedation and drowsiness with benzodiazepines, hypotension with antihypertensive drugs, nephrotoxicity with aminoglycoside antibiotics. Type C reactions are often related to the drug's pharmacological action and can be managed by adjusting the dose or switching to alternate medication. The type C drug reactions are related to long-term drug use and also include the tolerance. Type D. D stands for delayed. The type D reactions are also known as delayed reactions or adverse reactions that occurs after long latency period, often weeks, months or even years after exposure to the drug. The type D reaction become apparent sometimes after the use of the medicine. The timing of them this make more difficult to detect. Example is leukopenia, which occurs 6 weeks after the dose of lomustine. So the characteristics of type D reactions are delayed onset, occurs after long latency periods, often weeks, months or years after the exposure. Second one is unpredictable. It cannot be predicted based upon the drug pharmacology or the patient characteristics. Rare. It occurs in very small percentage of the patient taking the drugs. Often irreversible. It may be permanent and irreversible during the taking of the medication. Examples of type D drug reaction. First one, cancer, associated with the long-term use of certain drugs. Example, alkylating agent. Second one, involuntary movements, which is associated with the long-term use of antipsychotic drugs. Third one, osteoporosis, associated with the long-term use of corticosteroids. Fourth one, pulmonary fibrosis, which is associated with the long-term use of certain drugs. Example, aminodore. Fifth one, immunomediated reaction. Example, lupus-like syndrome, which is associated with the long-term use of certain drugs. Example, hydralazine. In type D drug reaction, they require a careful monitoring and may necessitate the discontinuation of the drug. Type E. E stands for end of treatment. The type E drug reactions are also known as end of treatment reaction or adverse reaction that occurs when a drug is withdrawn or its dose is reduced. In type E drug reaction are often related to the drug's pharmacological action and it can be predictable. Characteristics of type E drug reaction occurs when the drug is withdrawn or its dose is reduced, related to the dose pharmacological action and drug's pharmacological action, often predictable, and it can be managed by tapering the drug dose or switching to an alternative medications. Examples of type E reactions: withdrawal symptoms from opioids, benzodiazepines and antidepressant. Rebound hypertension after sudden withdrawal of antihypertensive drug. Rebound insomnia after withdrawal of sedative hypnotic drugs. Thyroid crisis after sudden withdrawal of thyroid hormone replacement therapy. Seizures after sudden withdrawal of anti-epileptic drugs. Type E reactions are often related to the physical dependence or rebound effect, and it can be managed by gradual tapering of the drug dose or switching to an alternative medications. Type F drug reaction. F stands for the failure of therapy. In type F drug reaction, it related to the common dose related and leads to the unexpected failure of therapy reaction and often caused by the drug interaction. The type F drug reaction, also known as failure of therapy, occurs when a drug fails to produce the desired therapeutic effect. Characteristics of type F drug reaction. The failure of therapy. The drug fails to produce the desired therapeutic effect. Worsening of condition. The patient condition worsens despite treatment, often related to the inadequate dosing or duration of treatment, resistance or tolerance to the drug, presence of underlying the conditions, interaction with the other medication, and the type of drug reaction also can be managed by the adjusting the dose or duration of the treatment, switching to an alternative medication, addressing the underlying condition, and monitoring of the drug interaction. And examples include antibiotic resistance leading to the failure of treatment, inadequate blood pressure controls despite antihypertensive therapy, and in type of drug reaction, the adequate blood glucose level failure to achieve and control the antidiabetic with the medication, and it also lack of responses to the antidepressant therapy. The type of drug reaction highlights the importance of monitoring treatment outcomes, adjusting therapy as needed, and considering the alternative treatment options. I hope everyone like this video. So please like, share and subscribe to Pharma Student.